Hi, everybody. Thank you very much for the kind introduction. Also, my name is Arnold. I'm a physical therapist by training. So today we talk a little bit about spine. Welcome, everybody. Before I start, if you have time, maybe type a little bit about your background. For example, if you're a medical doctor, nurses, or students, or researchers, or so that I get a better idea about who you are, and that will facilitate our later discussion. So today, even though initially I thought, oh, maybe it's good to talk about some management as well, but I think before that, given the time is around 20 minutes, I want in order to give you a better understanding about something I find very interesting, and yeah, it kind of may not be too many people aware of that. So that's why I plan to spend some time talk about some theories, some background, so that you have a better idea. We can have another other opportunities to talk about management of them as well. So maybe just start. Right. So I think here everybody knows that aging is a big issue, right? I don't need to spend another hour to talk about that, right? So you know that in this graph, WHO has already find that initially maybe back in 50s, it's only around 8% of the global population age 60 years or older, but you can see that in the near future, we're going to have around 20% of the people will be fall into this categories, and including myself by then. So that's why something we know that is very important. But so what happens in the world right now regarding other condition, right? So very common thing when you get older, probably you have, apart from have more wrinkles and or less active, probably you have another big issues, which is um, musculoskeletal pain, right? So in actually WHO predict that right now we have around 1.7 billion people is having musculoskeletal pain. Out of this, around 8.3 billion people. So around 20% of the people right now, every single day is having some kind of musculoskeletal pain. Of them, there are multiple, but most four common regions will be shoulder pain. You can probably heard of, especially for older adults, frozen shoulder, or some rotator cuff injuries or tears or something like that. Neck pain is not uncommon, right? So because we have like sitting in front of a computer, sometimes in front of the TV, we get used to or using a cell phone, your neck is always have a loading, and then you end up with neck pain. Knee osteoarthritis, I think everybody noticed that it's a big issues, which end up a lot of them having a total knee replacement or partial knee replacement and so on. Another common thing is low back pain, which is something I want to talk about. It is something I'm really interested in. So let's spend some time about back pain then. If you aware of, back in 2018, Lancet have a series, actually it's, for the first time, focusing on a particular disease, which is a musculoskeletal disease, which is low back pain. The reason for doing that, because they find that back then, or they recognize back pain is a major issue. If you look at the data from Global Burden of Disease, back in 1990s, the back pain has already rated as the number one cause of disability worldwide. And in fact, the number or the prevalence of that or the burden of it is much bigger than diabetes plus cardiovascular disease combined. And because of that, in this back in 2018, they have a series talk about back pain. So they have three important papers in this series. One is, what is back pain? Why is it so important for us? So they try to, first of all, is to raise awareness about that. So in this series, they have around 30 people across the globe. They're top researchers, clinicians. They talk about this. And then the second paper, they talk about the evidence, the evidence regarding prevention and sort of treatment of low back pain. What are the major challenges back then, and what should be done in the future? And then the third one also is take action, call for action. What should the government do? What are people have need to be done in the near future? So now when you look at that now is already 8 years ago. So this year, actually last year, they start the low back pain series too. So actually, fortunately, this time I'm involved in this series. We have 31 people. We are working like day and night on this particular project. So this time, one of the paper we are going to, you will hopefully you will see this in next year. We talk about um, after 2018, this series of paper, what's the impact of this low back pain series on the government, different levels, clinical practice guidelines, what actually affecting or the policy there. And of course, there's some more evidence regarding new treatment. What's a new treatment? What should we do in the future? Some people using like spinal cord stimulation. Is it useful or not? We have evidence regarding that. Another important thing is we talk about low and middle income country, MMIC, because that has been raised about this issue in the first series, but this series we are going to talk a lot about this one, and also we will talk about social determinants of disease of the low back pain, and also of course AI is another major issues we are going to talk about as well. So watch the space. So hopefully we will submit this series again by mid of this year, and then hopefully after a series of review, and we will publish this again next year. Um, Another thing is global burden of disease. You probably know of this one. And in back in 23, Miller and the group of researchers they look at the global burden of disease, and they at that time they put based on the existing data at that time they find that 2020 is already 600 more than 600 million people having back pain, and projecting back in 2050, it will be around more than 8 million people having back pain. So interestingly, in the past, if you think about like for some people, if they finished the school maybe 20 years ago or even 10 years ago, they always have the concept that, oh, back pain is usually happen among those middle-aged people, right? So young people, adolescent, probably they don't have back pain. If they have back pain, severe back pain, they have to go see a doctor. Maybe something wrong with them, maybe cancer or something. And then so probably when they get older, the disc will degenerate, and then you have protruditis, your PID, and then you have facet joint problem in middle age. And then after middle age, around 60, your back pain will get better. That was the concept back in 10 or 20 years ago. But now more and more evidence suggesting that, in fact, based on this global burden of disease, they find that what is the most common age group, this group, is around 60s or above. In fact, if you look at the peak, the prevalence, the most of the prevalence is around 80 to 85 years. And of course, to me, I think maybe this continues to rise. However, when you get older, probably due to cognitive decline, they cannot report it, dementia, or some of them has already died. So that's why you see the prevalence decrease globally after 85 years old. So that means what? That means back pain is a major issue among older adults. But the problem is, if you look at the data back in 2014, another group of researchers, and they look at the publication at that time, they say, oh, it seems like not too many paper actually including back pain management for this group of people. Because if you look at those paper, even up till now, many of the recruitment criteria for RCT involving back pain, they're 18 to 60 or 18 to 65. That's it. So anyone older than that, forget about it. But when you look at this reality, we know that there's a big gap there and has been missed a lot by researchers. And so now, hopefully, this will ring the bell and people start to be aware of these issues. And in order to check what's happened, because I mentioned that paper was 2014. So that's why our group will do another study, which is very simple, do a bibliometric analysis. Try to look at what's the trend of back pain over 30 years, like from 1993 to 2023. We try to look at whether like the number of publication related to low back pain in older adults and working age population. What's the trend there? And then we find that you see the trend is pretty similar, right? So the x-axis is the years from 1993 to like 2023. Over the 3 decades, you can see that the number of publication over time is pretty good. But when you look at the absolute value, right? So 400 for older adults, right, per year. And here it's talking about 4,000. So actually it's 1 to 10 ratio. So that means still this is an area highly like ignored and neglected by many of the researchers in the world. So that's why back in 2017, we start to aware of these issues, and we have, I think this is a pretty good paper. If you want to look at it, you can get a better idea about what low back pain in older adults, some risk factors, management options, especially for older adults as future direction. We target those people, those things for GPs and then primary care clinicians. And this has been highly cited. It's open access. Feel free to download it. And apart from that, we also later we try to update the prevalence and especially those people with chronic low back pain. And then we in this journal of pain articles, it's a systematic review back in 2022, and we find that is around up to 36% of those older adults, age 60 years or older, they're having chronic low back pain. So chronic low back pain by definition is you have the pain between your like 12 ribs and your buttocks and then between the with or without leg pain, and the pain lasts for at least 3 months or more. So with that, actually, this very disabling. You can imagine. Usually, back pain can be covered by itself, but if you can imagine, you have the pain more than 3 months on and off. Actually, it's very annoying, and this is the major group of people you want to focus on because they you use a lot of medical resources. They need our social resources. They may be socially isolated, especially for older adults. So this is a high prevalence of people. It's not simply have back pain, it's having chronic low back pain. So this is an issue we have to always consider. So actually recently we have some publication regarding what's the best treatment for this group of people. It's very promising. We use the some psychological intervention together with exercise, and then we find that the result is pretty sustainable over 6 months' time. So another thing I think very not too many people are aware of is because when we researchers we always think about, okay, let's do something, and then you want to do something that may not be what all the people or target group want. So we conduct a series of studies try to understand what older people they actually, especially those community dwelling, they're working around, if they have chronic low back pain, what do they want? What actually problem facing them? What is the need they need? So in this paper, very simple, we interviewed a group of older adults and then in Hong Kong, and then we try to look at what they think about the experience, and then we find some interesting outcome as well. So first of all, where it interests us is, of course, we expect, as expected, you find that they have a lot of disability they have social isolation, but something they also, for this group of people, they don't want to bother people, especially the family member, because they feel like they are the burden to the family. Even though they have their pain, they don't want to tell them because they don't want to be felt annoying, and they just keep it to themselves. So this is a major issue, and that also leading to like social isolation, depression. And then at the same time, we try to compare our finding with another group of people. They're Westerner, and then we find something very interesting as well. For those Westerners, they are more somehow they are more independent. So because they know that, like you can imagine if someone is living, especially in the States, right? Someone living in the East Coast and then the family is living in the West Coast, and then how likely they will see them? Maybe Thanksgiving, maybe Christmas time. Apart from that, you can just give them a FaceTime or a phone call. So that's why they are more independent. So that's why they rely on friends more than family members. So there's some cultural difference. And apart from that, we try to look at what about the globe. So we have this another new paper published 2025 last year. It's also open access. Feel free to download it. All these papers are free. So we talk about the lived experiences of older adults with chronic low back pain, and then what are the common issues among them, and whether they are different from younger people or anything unique to them. Again, those family issues come to place, and so this is something very interesting, especially those people who are interested in maybe social work or pain science. They will find this paper. Hopefully, you find them fascinating and inspire you to develop some of the research papers or projects in this area. All right. Traditionally, whenever we talk about pain, we always think, oh, that's a physical problem. You have pain for sure, and you may have disability, and then it's very disabling, and then you cannot walk around, and you need helper, you need other burden. Of course, you can imagine will lead to also depression as well, right? So, especially for older adults, they already have depression, and together with pain, and then basically, they will get worse. So new thing is some new paper we find that actually back in 2012, and then they find actually 2013 in JAMA International, they find something very interests me, which is they find that actually persistent pain, or you can call it chronic pain, is associated with memory loss and dementia. In this kind of long-term cohort, they have around like 10,000 people, and then they follow up them over 12 years time, and then they find what? they find that those over 10 years time, if those people with chronic pain and then they 10 years later, they are 16% more likely to have the risk of inability to manage their medication. Because of the cognitive decline, and 12% higher risk of having inability to manage their finance. That's a major issue. If they cannot manage their finance, end up they may need some more carer, more dependent on the family. And also, they have a absolute 2.2% increase in dementia probability as well, right? But we can argue that, oh, this is a simple cohort. What about others? So that's why we also conduct before that. So in this study, particularly this study, they find that across different domains, attention, working memory, short-term, long-term memory, executive function, languages, all of them actually get worse. So that inspires to conduct a new study. So that was published actually last year again, maybe this year, I forgot. So we look at four different population databases and from including those from Asia, including China, including the UK, Europe, and Australia. And then we find that this is a group of cohorts, right? Multiple countries, 17 countries, around 80,000 people. And then we find that on average, their follow-up time is around 8 years. And then for those people with chronic, this time focus more on chronic back pain because the previous study is more persistent pain, can be any regions. But here we talk about chronic back pain. And then we find that also, if you have persistent back pain at the very beginning, you have associated with memory loss and also subjective cognitive decline, and then the odds ratio ranging from 1% to around double, right? So it's big issues. So that also explains why I'm getting more and more interested in how to help this group of people. And then actually it's a big issue. People should start to be aware of this one. Um, and in this paper, we also find that there are several factors that are affecting those people with chronic pain. They are kind of moderator. They can modify the effect of the having cognitive decline. As long as you drink less after you have back pain, if you have any, try to stop drinking, try to quit smoking, do more physical activity, sleep a bit more, but not too much, right? You sleep more than 9 hours, actually it's getting worse. And then you have sleep less than 7 hours, you actually is not getting any better. So that's why is something as a clinician, frontline clinician, it may be good for you to like convey this message to your patients or their family members so that they know that if they do this, they actually is not only helping the pain, but also lower the risk of having future cognitive decline. All right. Actually, we have another new paper coming out next week from Journal of Pain Research. We look at the gene, we look at the genetic, we look at GWAS, also using the data from the UK Biobank as well as the Finnish cohort. And we find that also somehow genetic is also affecting this kind of result as well, affecting exercise and I mean back pain and cognitive decline. So of course, all I mentioned earlier is only some observations. You cannot really know what's the underlying cause. So that's why we have another paper. Feel free to download as well. This is we published in the Aging Research Reviews back in 2022, which is I think is a #1 paper in aging research. And in this research paper, we try to look at what's the potential mechanism that underlying the accelerated cognitive decline regarding people with chronic low back pain. And so we search a tons of different databases, and then we end up with 34 included studies. And so we identify certain mechanism that may explain what is the relationship or causal relationship between pain and cognitive decline. All right. So one thing is we have to know. So in this particular one of the included study, they find that during the attention task, when they do this, people with chronic low back pain, they demonstrate significantly increased activity in the medial prefrontal cortex compared to those asymptomatic controls. Medial prefrontal cortex, is it belongs to part of the brain. They call it in a network called the default mode network. This default mode network we call it DMN, which is a network area where help the people to focus on the internal sensation, internal feeling, and so on. So this is some similarity there. So for those people with ADHD, for example, they have a demonstrate overactivation of the DMN while they're at rest, especially or during tasks. Sorry, at rest, of course, DMN is supposed to be more active, but when they doing some cognitive tasks or attention tasks, they're supposed to be um, deactivate this moment and then use the lateral dorsolateral prefrontal cortex for thinking and so on. So that means that there's some similarity between people with ADHD and those people with chronic low back pain. That means they cannot deactivate this DMN when they need to deactivate. There's another study. They also find that in some study reporting some people with attention tasks with chronic low back pain, they also alter dorsolateral prefrontal cortex. Only one study mentioned about the dorsolateral prefrontal cortex being more activated, but most of these other studies they suggest that this part of the brain actually deactivated. But this part of the brain is very important because for DLPFC, which is the major brain part for cognitive function, making decision and so on. So they are for attention, for working memory, for decision making. If this part is less activated during this kind of task, then the performance will be affected. So what combined finding for these two is DMN becomes the medial prefrontal cortex become more activated, DLPFC becomes deactivated in this people with chronic low back pain. That means they're abnormal, they become less perform, especially when they need to do some cognitive task. So there's another study, next is a systematic review. They try to summarize all this kind of finding, and then they find that as I mentioned before, theoretically, when they need to be deactivated, people with chronic low back pain, they are less likely to be deactivated. And also there's some problem with the functional connectivity between the DMN and then the other network in the brain, and which may explain they maybe spend more time in the managing the emotion rather than spending time on cognitive function, which may explain why they cannot perform well for those tasks. Of course, there's some other studies suggesting that gray matter atrophy of the DLPFC, which is another obvious problem. So that may also explain structurally they have a problem. Functionally, they also have a problem in the brain. So that may explain why we observe. Apart from that, of course, everybody knows that with chronic pain actually is a kind of chronic inflammation. And chronic inflammation, you can see that from the bloodstream, in the serum, you find a lot of pro-inflammatory cytokine being activated. And at the same time, this kind of thing may also pass the blood-brain barrier and that lead to neuroinflammation as well. So our hypothesis, one pathway is when people have chronic low back pain, their entire system become more proactive. I mean, in terms of inflammatory biomarkers, they get think more together with someone. If they have insomnia because of sleep problem, they cannot sleep, also cause a kind of like chronic inflammation in the body, which in turns may somehow affecting the blood-brain barrier, causing some of the chemical or cytokines enter to the CNS, central nervous system, which will trigger some kind of microglia activation. So M1, M2, M1 is supposed to be pro-inflammatory cells, and then they become causing more and more inflammation in the brain, which end up in accelerated cognitive decline or neurodegeneration. Apart from that, we also know that, as I mentioned earlier, sleep is a problem. Sleep actually will activate the brain, activate the sensitivity of the whole system. That may lead to increase in pain sensitivity, which in turn, when you have increase in pain, and especially you have chronic pain, they may have poor sleep, and which is vicious cycle. You can see that when you have pain and then you have insomnia, you may be also at the same time chronic low back pain. We know that is associated with a lot of depression, and which in turn chronic inflammation. Again, same pathway. Again, I'm not going to repeat it. So this is another way to lead to these observations. And something, nowadays a lot of people start to talk about the gut-brain axis and so on. There's one study back then we find that actually now it's getting more and more study now. So one of the studies looking at people with chronic low back pain versus those people healthy controls, and then in especially in the obese group or overweight group, they find that for those people with back pain in this group of people, their guts have an altered microbiota composition, and this interestingly, what happens is in those people who are healthy, they have those healthy microbiome. They have different type of composition. So they have more like decrease in pro-inflammatory, and then they have more anti-inflammatory bacteria. But in those people with chronic pain, they seems to have more pro-inflammatory bacteria and also some more toxins. So one of the hypotheses is that so when you have low back pain, and then so is which is the but brain access to issue. I will talk about it a little bit further, but I just want to give you an overall summary, which is a hypothesis about why you see this observation. So just to overview, right? So we know that when have low back pain, we see the brain changes, functional, the connectivity change, and also the DMN become hyperactivated, DLPFC become less activated. Basically, they're competing with each other for resources and end up affecting the brain function. And also, structurally, we also see gray matter atrophy. And in the bloodstream, you will lead to chronic inflammation, and which will have a lot of pro-inflammatory cytokine, which will damage the blood-brain barrier, which also lead to M1 problem, which is the cycle degeneration. Back pain also associated with insomnia, depression. These also lead to vicious cycle. And then some other issue is you have the gut, right? So if you have leaky gut, probably heard about that. So if there, for some reason, we don't know. Maybe the gut lead to the brain, maybe the pain lead to the gut problem. Anyway, they seems to have some indication of microbiota changes, which may lead to some toxin get into the bloodstream, which happens is just like chronic inflammation, and then vicious cycles go on. So this is an overview of in this particular paper. For interest, please go to that paper and more detail. Before I end, I want to remind you we are going to have the 20th International Forum for Back and Neck Pain Research in Primary Care, which will happen in Hong Kong next year, May 10 to 13. I'm the host. I really welcome you to join because that will be, you will see all kind of top researchers in the world in spinal pain. All of them, you find them in Lancet, in New England Journal of Medicine. All of them will come here and they will give a lot of talk, running a lot of workshop, collaboration. This time, the reason I bring it to Hong Kong because we want to involve Asia. So for those people interested in pain science, want to collaborate, want to talk to those top scientists, research scientists in the world in spinal pain, please come join us. And again, I welcome you to European Spine Journal. If you have any paper regarding pain, regarding spine, regarding research, regarding spinal surgery or disc issues or scoliosis or anything, we welcome you because we have two awesome editor-in-chief, Ricardo and Dino. So we're working closely together. And this year, you can see that in 1 month, we actually have a record high of submission. So thank you very much for your time, and I will take your questions.